My name is Dr. Shankar Prasad. I'm a physician and today I want to discuss with you regarding the thyroid gland. Thyroid gland is an endocrine organ which is located in the neck region and it produces the hormone called as levothyronin and levothyroxine which actually regulate the human metabolism. What we mean by that is the thyroid gland is very important for each and every cell to do its functioning in the human body in a proper way. So the thyroid gland problems that commonly people talk about can be one, an enlargement of the thyroid gland, which is called in medical terms as goiter. So in a goiter, the functioning of thyroid can be normal or abnormal, but the thyroid gland looks very much enlarged. So people start seeing an enlarged gland in this particular region. They find it as a swelling. Sometimes it becomes a very large swelling in extremely neglected cases. Normally, this could be physiological, this could be normal during pregnancy or when somebody is growing age, which is typically around 12 years to 20 years of age. In that particular age, the finding of a goiter could be normal. Sometimes it could be abnormal. Apart from this, the functional problems of thyroid are basically two types. So this thyroid gland can become hypofunctional, or the functioning of thyroid can come down, or it can become hyperfunctional, wherein the functioning of thyroid gland can become excessive. So in hypothyroidism, because the thyroid gland reduces its production of thyroxine hormone, so the patients commonly experience dullness, lethargy, slight tendency to gain weight, increased fluid tendency, retention in the body, producing round face or producing a very shiny face and shiny legs, shiny feet, etc. Abnormalities in menstruation, typically scanty menstruation, sometimes excessive menstruation, hair fall, etc. So constipation is another common symptom that people find with hypothyroidism. In extreme cases, patient can become very, very dull, moribund and can also go into coma. In hyperthyroidism, it is exactly opposite. The thyroid gland starts producing excessive hormones. So because of excessive hormones, the metabolism starts doing excessive function. In hypothyroidism, the metabolism is suppressed. In hyperthyroidism, the metabolism becomes excessive. So as a result of excessive metabolism, the patients start having fever. They eat a lot, but they keep losing their weight. They'll have palpitations, their eyes will become very prominent and they'll be losing weight very steadily in spite of eating a lot and having a good appetite. Or they can have a chronic fever. They can have fever which is going on for many, many months and somebody would diagnose it as some kind of typhoid or whatever, but generally turns out to be hyperthyroidism. Third set of problems with thyroid generally relate to the tumors of thyroid or the malignancies, the cancers of thyroid. The cancers of thyroid have the longest life expectancy, which runs into more than 20 years and more. The papillary carcinoma is the typical cancer of the thyroid, which is detected only with enlarged lymph nodes or a tiny swelling, rarely produces any symptoms, but will require some medical attention and medical treatment to be done. The treatment of thyroid disorders essentially in modern medicine is concentrated around supplementation of thyroid hormone in the hypothyroidism conditions and in suppression of the thyroid hormone by using anti-thyroid drugs in hyperthyroidism. The diagnosis of thyroid is very, very important, particularly in pregnant women. Any woman, any lady who's being pregnant in the first trimester of pregnancy essentially should get herself evaluated for a thyroid, and if they already have a thyroid problem, should try to maintain the thyroid gland, the thyroid hormonal levels within absolutely normal range. So thyroid gland by its normal functioning, by its diseases, produces a host of abnormalities which are extremely common in the present day society and which produce something very significant, more so in pregnant ladies, because if it is not diagnosed properly, it can give rise to low IQ in children, mental retardation and problems like that. Hence, understanding about thyroid is very, very important for most of us.